Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. We're taking your calls at 866-870-5752. That's 866-870-5752. And please check out Dr. Darrow's website at www.jointrehab.com. That's jointrehab.com.
Wonderful. So this is the show Living Pain Free. I'm Dr. Marc Darrow. I did my medical residency at UCLA, and my office is just down the block from there. And I've been doing regenerative medicine for over 25 years. I was one of the bigger players in the beginning of this, and I think I still am. I think our clinic sees more patients than any other clinic I have found so far. So hopefully you're in good hands, and we now have Dr. Thomas Grove, who's on board with me, who is very, very well trained in regenerative medicine. He's been involved with it for the past 10 years, and he's very well trained in ultrasound guidance with the needle. And his training actually is better than mine, believe it or not. I sort of intuited how to do this, but he's been trained by the masters in this country, and he's traveled all over the country to be doing this work, and I'm so grateful for you, Dr. Thomas Grove. You are an amazing person. He was a college athlete. He played for the Cornhuskers. He was a linebacker. Big dude, handsome dude, and got a great personality. You're going to love him. He's doing most of my injections for me now, and I'm very grateful. That's all I can say. So I'm going to give out the phone number so you can give us a call. And then we're going to get to a really, really interesting question.
Well, we have Rick on hold. Do you want to talk to Rick?
Rick, Dr. Marc Darrow, how are you?
Hi, Doctor. Great to talk to you. I've talked to you once before. I have a question about the meniscus and the work that you do in that area.
Tell me.
I have had my knees orthoscopically dealt with 3 times for torn meniscus.
One knee 3 times or 2 knees?
All 3 knees. Yeah. 2 knees 1 time and the other knee, or both knees, whatever, 3 different times, twice on one and one on the other.
Okay.
And the surgeries were relatively successful. I didn't know about you back. My first one was 25 years ago. But
Sure.
I have a close friend right now who's 65 years old, extremely active. I could go on and on about the amount of abuse his body's been through. And he is now at 65, finally been diagnosed with a torn medial meniscus.
Okay.
He has a good friend who is an orthopedic surgeon. And he himself is a registered nurse of 35 years. But he doesn't want to have surgery, and I've told him about you. I gave him your office's phone number.
Thank you so much.
You're welcome very much. I'll be seeing him tomorrow, and I would love to give him more information about what injections can do in an area of our body that doesn't really have a great blood supply. What little I've learned about the meniscus is that it doesn't really have a strong blood supply, and that's why he has so much fluid in his knee right now. I'm just wondering if you can give me some information to share with him.
So, Rick, I have meniscal tears in both my knees, medial meniscal tears, and if you want to stop in the office, I will show you with an ultrasound that's the truth. I have no pain in my knees. I'm able to run up and down the mountains where I live with my husky dragging me, my husky dog. And you'd say, well, how can that be? Because I've injected them both with stem cells and platelets. So are they perfect? Well, according to the ultrasound, they're not. But I don't know if you were listening to the show before. I also have 2 rotator cuff tears in my shoulder and a labral tear, and I have no pain in those either because I've injected them. So we can't look at the anatomy to decide if we have pain or not. That's number one. All right? Now, before I treated my knees, the menisci had pretty big cuts through them. They don't anymore, but they don't look perfect under ultrasound. They just look a lot better. I used to have a lot of fluid. I had 45 cc's of fluid in my right knee. That's gone. My left knee had about 30 cc's of fluid. That's gone. I beat my knees up. I beat up every part of my body. I am 75 years old, but my mind tells me that I'm still 16. So I still work out hard, and I take care of myself, though. So a couple things here. Number one, we bring the blood supply to the area. That's the whole point of this. So you can go to an area that's what we'll call a white area instead of a red area, where there's no blood supply. We bring the blood supply there, and we create a little inflammation that brings more healing cells to the area, and we'll inject stem cells that grow tissue and platelets that stimulate tissue to grow. So I can't promise anything about your friend, but I can promise you this: we do tons of meniscal tears every single day. Okay?
Okay. That's great. That's great to know. And I totally believe in what you're doing. And he is not pro-surgery. He has torn rotator cuffs that he's refused to do surgery on. So I can share that too. He's just dealt with it and limited his range of motion and modified his workouts. But I know he'd be interested in that too. So I'll definitely pass that on to him.
Thank you. Thank you so much, Rick. By the way, I have people come in who have complete rotator cuff tears all the way through, cannot lift their arm, and they can get better too. I have people with ACL ruptures. You know what the ACL is? The anterior cruciate ligament in the knee.
Right.
They come in, their knee is full of blood. They could have 100 cc's of blood in there. I use the ultrasound, take a look inside, I see there's fluid. The ultrasound guides the needle to every spot to take out every drop of fluid. And guess what? They get back to their sports.
Yeah, that's amazing.
Now,
Totally
the surgeon says they need a repair. But there's a lot of people that don't need a repair. And to tell you the truth, there is only one person in over 25 years of me doing this work that, in my opinion, needed an anterior cruciate ligament repair. And the reason was he is a big wave surfer and drops 100 feet from the top of the wave to the bottom. And I didn't want to take a chance with that knee.
Yeah.
But I have tons of surfers that are still surfing after anterior cruciate ligament tears, rotator cuff tears, arthritis, you name it. Do they get surgery? No. Why are you going to get a surgery when you don't need to, and you can get an injection and walk out of the office? Doesn't make sense to me. There are cases where surgery is needed, but it is rare compared to the people that don't need the surgeries. If you got your leg smashed, or your bone is broken, you need a surgeon. But meniscal tears, typically no. Rotator cuff tears, typically no. Herniated discs in the back, neck, typically no. Arthritis, typically no. I mean, I get tons of people with failed surgeries. They go and get a surgery, they come out worse, and then we can get them better. And I'm not promising you anything. There's no promises in medicine. I'm just telling you, in my experience, the medical system is backwards. But what isn't on this planet? It's a money-driven system, and it's a shame. It makes me sick. It literally makes me sick.
Okay, sir. I'm going to pass as much of that I can remember on to him and have him give you a call.
Yeah, he can call me. The number to our office is 800-300-9300, and he can get a free consult with my staff if they think he's appropriate, we'll get him right in.
All right. I very much appreciate it. And I have passed this number on to him, your number on to him, and I'm going to be seeing him tomorrow, and I'm going to share all this with him. Thank you very much.
God bless you, Rick. I really appreciate it.
Thanks
and
for your call.
I do want to mention something that Rick said.
Okay.
He had 3 knee surgeries, and he thinks that he did relatively well. He said his words were relatively successful. But the question is, if it's the type of surgery that's not just sewing things up and putting them back together, typically it's removal of good tissue. So if you ever look at the film, the video of a knee surgery for meniscal tear, you'll see them taking tissue out. How long is that knee going to feel good for? Yeah, they'll feel good for a while. And I have this happen all the time. I counsel people not to do the surgery and just use platelets or stem cells to heal it. And they don't listen. They're enamored by surgery. Their friends had a surgery that, quote, worked. And then they come back a couple of years later much worse off than they were before the surgery. We can still help them, though. So don't think because you had a surgery and you feel good that that's going to last. We don't know. Same thing with my work. We can do regenerative medicine. You may need to come back for treatments later. I've got one patient who's a very high-level skier and bicycle racist, and he comes in at least once a year for tune-ups. But he is an animal. He's going to wear it down. And he comes back and goes, I don't really have any pain, but I want to make sure that what I had never comes back again. He's a smart man.
Well, my question would be, how come he had 3 surgeries? Why didn't the first one work?
Well, 2 were on one knee and 1 was on the other knee.
Okay, I would ask.
But I get you.
You know what I'm saying.
Yeah, I get you. And we have that all the time with people coming that have had 2 or 3 back surgeries, ready for another one. Their doctor says they need another one. I do an exam and I go, surgeries haven't helped you because the area that the pain is coming from is not where the surgery is even being done. And then we heal them up. We see this often in the hips where a surgeon says you've got hip arthritis, and then they do a hip replacement. Get worse. Why? It wasn't the hip joint that was the pain generator. There's a lot of areas around the hip joint that can cause pain. And I actually have a question that came in that, if it's okay with you, Nita, I'm going to get into, because I love this question. So I'm going to give out the phone number. You can call me live right now, talk to me, get a curbside consult at the studio. I'm at 866-870-5752. If you want to watch videos, go to the website, which is www.jointrehab.com, or you can call the office to get an appointment or to talk to someone, get a free consult with my staff at 800-300-9300. That's 800-300-9300. So let me track down this question because it really is a good one. This one says adductor magnus. If you want to look that up, go to Google, put those words in, adductor, A-D-D-U-C-T-O-R, magnus, M-A-G-N-U-S. And then the upper left, on that page on Google, you'll see a spot that says images. Click and you'll see diagrams, photographs, paintings of what the adductor magnus is. So the person goes, Hi, Dr. Darrow. I was diagnosed in early June with grade 1 partial thickness tear of the adductor magnus origin. So we have what's called the origin and the insertion of muscles. The origin is the part closest to the body, the middle of the body, and the insertion is the part that it attaches to farther out. It was painful to sit, and I had frequent flare-ups of aching pain at the origin and upper groin area on my right side for 2 to 3 months. So the area in the groin where the origin is And by the way, that adductor magnus muscle is that big muscle right in the middle of your thigh. Okay? And it goes all the way to the the origin point, which is in the groin, on the pubic bone. All right? So the pubic bone is that bone in the middle, and there's a lot of attachments to it. My physical therapist in mid-July, since healing did not seem to be progressing, recommended not trying to limit inflammation with ice and recommended using heat. Well, who cares? Neither of them are going to do that job. Light cardio, walking, very light adductor isometrics. Well, none of that stuff's going to do the job. Okay? In my experience, I gradually felt a little better to the point where I was feeling okay from early September, early October. We then did a very light session with a weighted sled push, and my upper groin flared with a painful ache the next day, and has been very similarly flaring every 2 to 4 days since for about a month. The flare-ups are very painful and last 6 to 12 hours each. I'm not having much luck controlling the flare-ups, and an orthopedic doctor I see suggested PRP as an option. That's a great option. Make sure that guy knows what he's doing because it's a dangerous area to inject. There's all kinds of nerves around there. My primary physician, that's a different doctor, concerned about risk of heterotopic ossification. You can look that up. Heterotopic ossification. If I have a PRP injection to my adductor magnus, do you think you can help? Please help. Thank you. Thank you, Dr. Darrow. I appreciate you. All right. So, I got a lot of information here. Number one, I personally have been doing PRP and stem cells for over 25 years. I have never, and I do it all day long, and I treat adductor magnus tears all the day long, and I've never seen one flare into heterotopic ossification. What does that mean? It's a condition where bone grows around or calcification occurs around a trauma site. I saw this very, very often when I was doing spinal cord injury and brain trauma at Rancho Los Amigos Hospital during my internship. Very common to get heterotopic ossification. What does that mean? Typically, it is from a trauma, okay? Or immobilization, paralysis. It can be from severe bleeding into that area. It can be genetic. Could it be from PRP, stem cells? I've never seen it. I'm going to go look it up to see if there's any cases of it, but I doubt it. So, don't ask questions of doctors that don't do the procedure because they don't know what's going on. I'm not saying they're stupid, but I'm saying they shouldn't be giving information about what they don't know about. Okay? Any questions about that, Nita? Did I cover it?
No, I feel like I just got a little bit of an education there with all these new terms.
Yeah.
So that was great.
Yeah. And another related area is very common. It's when people have pain on what we call their sit bone. Okay? Ischial tuberosity, where the hamstring muscle attaches. Can hurt like heck. Is it a big deal, even if it tear? Nope. We work on them all the time and heal them up. What do the surgeons say? We need to operate on, reattach it, blah, blah, blah. Fix that tear. Nope. Never had to do that so far. If the entire muscle belly is ripped off and it's down the leg, you need a surgery. PRP and stem cells, regenerative medicine, doesn't work on everything. But it works on a lot of the things that a lot of doctors say you need surgery for when you don't. Surgery is invasive. What I do is not. Simple injections. Got to make sure you go to a doctor who knows how to do this stuff, because the failure of regenerative medicine is for people that go to I'm going to call him a bad doc, some guy who goes to a weekend workshop and then thinks he can do it. No, you need tons and tons and tons of training with this, tons of training with the ultrasound so you can see inside the body. Another one of the failure rates is not enough treatment. It's not regenerative medicine of stem cells and platelets is not a magical treatment. All it does is stimulate tissue to grow back. That can take a few treatments. So people come in, they've had one PRP treatment, they go, it didn't work. I go, it's working. Give it a break. You may need more treatments. Another reason is ibuprofen. What's ibuprofen? An anti-inflammatory. We are creating inflammation, a short burst of inflammation, which brings fibroblasts, which are cells that grow collagen and cartilage, back to the area. Okay, so I've seen tons of joints before and then after we've worked on them where we see the cartilage thicken up and grow back. And then another failure of regenerative medicine is too much activity. Many people cannot stop working out or do that activity that we're trying to heal. So if you have a hammer and you're banging your knee and I see you in the office, I said, give me the hammer. You're hurting yourself. And they go, well, I can't. That's what I do, i.e. my sport. And I take the hammer away finally when they get sick of the pain. We inject them. They come back the next week and go, it didn't work. And I go, you got a hammer in your hand. What have you been doing? Well, I got to work out. No, you don't got to work out. You got to let things heal, then work out. What's it called, Nita? Delayed gratification?
Yeah, that's right. Exactly.
Yeah. And I'm not the best at delayed gratification. Who is? I had an incident that I want to follow up on. I had a cardiac ablation 2 weeks ago Wednesday, so it's about day, what is this now? It's about day 19 post-op. And I was warned by my surgeon, electrophysiologist, do not do anything. Give this a chance to heal. And it was for atrial fibrillation. Well, I thought walking would be okay, right?
Uh-oh.
So I waited till day 4, and too bad. Too bad, show's over.
We are out of time.
Anyway, I screwed myself, but I'm okay. I'm healing. Anyway, call the office 800-300-9300. Go to the website, www.jointrehab.com. Watch the videos of stem cells and platelets. And thank you, Nita Valens, Suzette, Alex, and the crew. God bless you all, and all you listeners and callers, we love you.
Thank you, too.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab experts for free and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 8 a.m., 10 a.m., and 1 p.m., and Sundays at 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.